So, tell me a little bit about which psychedelics you've looked into or are looking into. I'm obviously MDMA, LSD, peyote, ibogaine, DMT, psilocybin. Like, talk to me about
Mhm.
those.
I mean, we can talk about literally any of those. Now, I'll start with by saying that MAPS's research, our kind of thrust of our research has been with MDMA,
Hmm.
and we just published in Nature Medicine the results of our first phase 3 MDMA for PTSD trial, which is
Mm.
part of the drug development studies that we're taking through the FDA right now, with the intention of making MDMA a prescribable medication in the next couple of years. So the goal there is to really kind of undermine this perception that the criminalization of psychedelics is based in science, because right now it's not, and kind of bringing some of that science and evidence to it to have actual evidence, not just to show evidence, but actually bring it into a healthcare context where it can be used and its benefits could be maximized. So MAPS's focus has really primarily been on MDMA as far as our drug development goes. However, we've done quite a bit of sponsorship. We sponsored observational research also with some of those substances you mentioned. So I think ibogaine, ayahuasca, LSD, maybe peyote in the past, or mescaline in the past. And what we found, and what I think has been emerged over this kind of new wave of psychedelic science, is that each of these substances has a slightly different kind of imprint. They work slightly differently. Their therapeutic benefit or risks are slightly different. So I would say pick one and let's talk about any of them, because
So,
I'm happy to go down the rabbit hole.
So let's start with MDMA. First of all, is it fully psychedelic? Because I think I've heard different things on that. I'm curious what the answer is. And then how did it work in alleviating anxiety, depression, PTSD, or any of those issues?
Yeah, this is a great question. So I'll start with the one about is it a psychedelic? Because I think this to me is kind of a similar question to, is cannabis a psychedelic, or
Right.
what is a
Yeah.
psychedelic? And the word itself, as you might know, comes from the root Greek, two Greek phrases that essentially mean mind manifesting. The other word that you sometimes hear used to describe psychedelics is entheogens, which is something that means that it inspires or brings out the divine within. MDMA is what I think some people call an entactogen or empathogen. So it's a psychedelic which actually has mind manifesting effects, or manifesting effects on an emotional level. People usually
Mm.
associate psychedelics with hallucinogens, or drugs that actually affect visual formats. You're like seeing stuff and whatever. And that's certainly true for some psychedelics, but our definition of psychedelic is slightly broader. That actually includes this emotional and sometimes spiritual effect, which may or may not come with visuals. And in the case with MDMA, it usually doesn't. MDMA
Mm.
is usually a pretty stable substance, and it's associated more with amphetamines, which is a class of substances that really fall outside of the realm of visionary, trippy things most of the time. So,
Gotcha.
yeah.
Go ahead. You're probably going to go on to talk about what you found in the trials, which I think both of us covered on our shows and
Yeah.
like was
Yeah.
incredibly promising.
Yeah. So I can just summarize it then, which is to say that what we found is that in our phase 2 and then in this confirmatory phase 3 trial that we just published, we found that after MDMA therapy, about 67 or 68% of people no longer qualify for having PTSD.
Wow.
And there's a couple ways that we've interpreted that works, and I will note that FDA research doesn't usually require mechanism of action, which just means that to take a drug through FDA, you don't actually need to know how it works. You just need to know that it's safe and that it works. But with MDMA, we sometimes use the phrase memory reconsolidation to describe what happens. So it reduces the effect of the amygdala, which mitigates fear, and it increases compassion. And, there's kind of a stereotype or kind of a trope of people taking MDMA or ecstasy and being really huggy and friendly and loving and whatever. I think that that's true because it does increase compassion and empathy. And usually when you're like in a club or a party or celebratory setting, that just goes outward.
Yeah.
The way MDMA therapy works is that it's actually done with a therapist or with a facilitator who actually, it kind of acts as a mirror and allows you to put that empathy and that compassion back toward yourself. So it's actually a process of, you're not, unlike other psychiatric medications that are more based on repressing memories or affecting the chemical makeup of one's brain. MDMA therapy, and this is true of a lot of psychedelic therapy in general, is really about opening up channels internally, seeing whatever that trauma or whatever the root cause of that harm is, and engaging with that in a really, really active, intentional way. So it's more like a surgical intervention. It's not like palliative. You don't do it every day for the rest of your life like you might with an SSRI. It's actually more of a short period of time, maybe 2 or 3 administrations of the medicine total. So after only 2 or 3 administrations of the medicine total with therapy before, in between, and after for preparation and integration, which are crucial parts of this, that is how these results come out. So we like to say that the actual benefit is really in the therapy that the MDMA makes easier, because it's really about like getting to that root stuff. Yeah.
Well, only 2 or 3 administrations of the medicine. I mean, that doesn't sound very profitable. So I don't know how this is going to work out in America, which actually is a whole separate thing I want to get into with you.
Yeah.
But first, if you could tell me a little bit more about how these studies are conducted, because one thing you said that I think is really important is it's not like you're just giving people MDMA and then evaluating the results. This is done in a therapeutic context. So how do you do that in a way that is scientifically consistent so that you're able to get reliable results?
Yeah, one of the ways is pretty straightforward because it's just part of the scientific method, which is controlling as many variables as possible. So the first thing is, I mean, and this might go without saying, but because we're doing clinical trials, we're using substance that's completely pure or close to pure. And that's a big deal because a lot of people who are getting ecstasy or MDMA in the underground are usually getting something that's adulterated in some way or another. And that's a function of prohibition. So maybe there's a version of reality in the future where we have legal regulated access where people, even without diagnosis, can also access MDMA. But for now, as long as we're in the current drug control paradigm, there isn't a guarantee that anything that's bought in the underground is pure. So starting with a pure substance, I think, is a big part of it and kind of more difficult to achieve in certain contexts, especially in the underground than others. The other is exactly as you said, this kind of therapeutic container. So the MDMA for a PTSD protocol is actually, I think, 12 to 15 sessions total, which includes 3 sessions before, 3 sessions at the very end, and then 3 sessions in between each of the administrations. So we're talking about, something like 3 to 4 months of therapy with a dozen sessions, only 2 or 3 of which have MDMA with them, which is where a lot of the deep work happens. But you're definitely doing work before to prepare. You're setting intentions. You're mapping out what things are causing harm or things are causing an impact, and then after you're integrating them. So people sometimes talk about their downloads or the amazing things that they learn while they're tripping on psychedelics. Well, that's only really useful if you actually learn how to integrate those learnings into your day-to-day. And sometimes that's easier than others when it's like, oh, you know what, maybe I should have a morning routine and that's going to make my life better. Like, that's something that's not always easy for people to do. And maybe it's something really big, like, oh, I should leave my job or I should do this. One piece of advice for anyone watching, it's really important not to make big decisions any 2 weeks in the 2 weeks after you take a psychedelic, because sometimes it can really affect your way of thinking, which is sometimes a really good thing, but it's good to integrate that into where you're actually at. And I think that's the level a lot of people skip. So I think that's the part where when it comes to MDMA as a modality, yes, it's true that it's this amazing substance that can increase compassion and empathy and so on. But part of the reason it's beneficial for highly sensitive people with real mental health disorders is not just because it's a great drug that does a lot of stuff. It's also because it's done in a really safe, responsible environment with support.
So you mentioned that the research is MDMA in regards to PTSD. Is there any information about anxiety or depression, or is that, I think there was a psilocybin study on that going on somewhere. So just speak on that a little bit, if you don't mind. Yeah,
so we have done some other studies with MDMA. We've done a conjoined therapy study, which is 2 people, a couple, where one of the people has PTSD. I think we're studying MDMA for eating disorders, social anxiety, for adults with autism, for end-of-life anxiety. There's a few other, potential indications or potential kind of routes that are being studied. But yes, to your point, the studies that have been really focused for chronic depression or treatment-resistant depression have been primarily with psilocybin, the active ingredient in magic mushrooms. And a lot of the studies that are kind of really well known around depression and also end-of-life anxiety are also with psilocybin. So you're kind of on this parallel track where MDMA and psilocybin are both very close to each other, actually timeline-wise, with respect to approval through FDA or potential approval through FDA. Both received breakthrough therapy from FDA. There's a lot of promising research with both. The other thing I'll add with psilocybin is smoking cessation. And I think that with psilocybin and other psychedelics especially, this may be true with MDMA through the route of trauma treatment, because a lot of substance use disorders are trauma related. Not every single one, but a lot have origins in trauma. So there's a way we're working on PTSD can work with substance use disorder. But psilocybin and some other psychedelics, ibogaine, for example, ayahuasca, LSD, are more well known for their effects on alcoholism, opioid use disorder, other kinds of substance use disorders that kind of have to do with this like fixation or this dependency behavior, because it's really about like kind of unweaving those channels in one's mind that kind of lead to the same chronic outcome, if that makes sense.